Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Okay, welcome back. This is actually part 2 of my podcast episode. Steroid drugs, also known as corticosteroids, they're used for inflammation. How they deplete important nutrients. The steroid drugs have many toxicities and side effects. And of course, this may be even caused by some of these depletions, or it's certainly aggravated, compounded by some of these depletions. And in the first part, I discussed how steroid drugs like hydrocortisone, Medrol, which is methylprednisolone, prednisone, how they could deplete vitamin B6, how they could deplete your microbiome, and the effects this has on your health, because it's definitely going to have effects. Today, I'm going to go a lot further in the nutrients that are depleted by these drugs and use that also as a platform to teach you about these nutrients. So, thanks for tuning into today's Invite Health podcast. You can find all of our episodes for free wherever you listen to podcasts, or visit invitehealth.com/podcast. Please subscribe and leave us a review. You can also follow us on Metaverse, Facebook, Twitter, and Instagram at Invite Health, and the information on this episode is linked at the episode description. By the way, my name is Jerry Hickey. I'm a nutritional pharmacist. I'm also the senior scientific officer over here at Invite. So let's get going. We already discussed, we discussed vitamin A, probiotic bacteria, and B6 so far. Now we're going to discuss vitamin B9, but nobody ever calls it that. They only call it that in textbooks. It's actually called folate. And let's just get this up front. Most multivitamins use a synthetic folate called folic acid. The problem with that is many people have trouble converting that into the active form. So if you're on a drug like prednisone at a high dose for a long time, you really want to make sure you're getting the active form of folate. It's called methyl tetrahydrofolate, and this way you can avoid a lot of problems with the drug. So high doses, high intakes, I should say, of folate and B6. It's called folate, by the way, because it's ubiquitous in foliage. But it's not easy to get out of foliage, and like I said, some people can't activate it. So if you're going to get a supplement, get the methyl tetrahydrofolate. It's the active form of this nutrient. But there's a reduced risk of dying from a stroke, or dying from heart disease, or developing heart failure when you have sufficient folate and B6. Both of them are depleted by the drug. So you want to make sure you take some of these. You get at least some of these, okay? You want to make sure of that. The thing is, folate also reduces a byproduct of protein metabolism called homocysteine. Elevated homocysteine chips away at your joint health, and that might be one of the reasons why steroids are bad for your hip joint. But homocysteine also can contribute to depression and eye disease, so maybe that's compounding the side effects of depression and eye disease and mood problems that you get from the drug. But it also lowers the risk of cancer. And, by the way, Alzheimer's disease. Elevated homocysteine in the brain is a big risk factor for Alzheimer's disease. You want to lower the homocysteine levels. But you need the active folate to help reduce the risk of cancer, because folate shields the DNA inside your chromosomes. Like women have 2 X chromosomes, men have an X and a Y. And things like viruses and radiation and pollutants, etc., and pesticides can cling onto and damage the DNA and lead to mutations, and if the mutations are copied in the wrong way, it can lead to cancer. So folate helps prevent the first 2 steps in the cancer process, which is called initiation and promotion. After that, you have the cancer, and after that, there's metastasis, where the cancer grows and spreads. So you need your folate, and the drug depletes folate. Make sure you're getting some. B12. B12 could be adenosylcobalamin or methylcobalamin. Unfortunately, in most multivitamins, it's cyanocobalamin. It's B12 attached to cyanide. Now, it's not toxic. The cyanide won't hurt you because it's attached to the B12. But it doesn't work in everybody. So I tell people if you're on these drugs, get methylcobalamin. Methylcobalamin is fully activated B12. That's really important for your brain and energy production. But methylcobalamin goes through all the different pathways that you would expect B12 to go through. So it's converted to the adenosylcobalamin, which is also called cobamamide. So the best form to get, I think, if you're on a drug that depletes B12 would be methylcobalamin. You need it to make your red blood cells. If you don't have it, one of the things that happens is your red blood cells get really big. It's called megaloblastic anemia, and they can't carry oxygen anymore. So you're going to get fatigued and all kinds of symptoms. You also need B12 to make your nerve cells. B12 has been connected to a lower risk of colon cancer, depression, osteoporosis. You also need it to reduce homocysteine. It works with the methyl tetrahydrofolate to reduce homocysteine. And I said before, elevated homocysteine is strongly connected with Alzheimer's disease. It's probably not the only cause of Alzheimer's disease, but it is one of them. And by the way, B12, B6, and folate are commonly lacking in older people. Older people like myself are commonly low in B12, folate, and B6, and this drug will only compound it and make it worse. So older people really have to pay attention to this. Vitamin C. Steroids commonly deplete vitamin C. Now, vitamin C is really important for protecting your brain. You need vitamin C to interact with vitamin E to prevent damage in your brain. They've shown that people who are generally high in vitamin C and vitamin E have a lower risk of dementia. There's a number of studies showing this. You also need vitamin C and vitamin E to protect your lungs. In your lungs, there's this very thin layer of fluid and these little hairs that move dusts and pollens and particles out of your lungs. And the thing is that that surface layer of liquid has to be loaded with vitamin C, vitamin E, and an antioxidant enzyme called glutathione peroxidase to really protect your lungs from things like soot and smoke and pollutants and danders and everything. But vitamin C is also needed to make your skin, your hair, your nails, your bones, your joints, your brain, because you need it to make connective tissue and collagen. Literally, if you lack vitamin C, you melt. Your hair falls out, your nails fall off, your skin peels off. Sorry, sounds dastardly, but it's true. It's called scurvy. Shows you how important vitamin C is. But vitamin C is needed by the immune system, and vitamin C levels drop in the winter, by the way. We have less vitamin C in the winter just when we need it to fight off the flu and colds and COVID-19, etc. Because you need it for chemotaxis and respiratory burst. When somebody sneezes on you with a virus, your immune cells have to get to the site of the virus. To do that, they soak up all the local vitamin C, any nearby vitamin C. And then they can move over to where the virus is. That's called chemotaxis. There's no chemotaxis without vitamin C. But you also need it for a respiratory burst. For the immune cells to kill the virus, they have to release their arsenal of weapons. They can't do this if they lack vitamin C. So you don't want to have vitamin C depletion. It's very unhealthy. Vitamin D, okay. Vitamin D is depleted by steroids, but that's compounded because vitamin A doesn't work also, and vitamin A is needed to control your steroids. You need your vitamin D to absorb calcium. You need your vitamin D to help your muscles function, your nerves function, your brain function properly. You need vitamin D to prevent acute respiratory distress syndrome if you get a virus. Otherwise, you could destroy your lungs. The lungs fill with fluids. You wind up on a ventilator, and that's the end of it. You also need vitamin D to survive cancer, by the way. There's plenty of research for that. And in fact, there's research showing that if you're sufficient in vitamin D, you have a lower risk of developing COVID-19, and you have a lower risk of winding up in the intensive care unit, and you have a lower risk of winding up on a respirator, a ventilator. When you're on these drugs, you lose your zinc. Now, that's a real problem. Once again, older people have trouble absorbing zinc from food, so it's even worse in older people. Many people don't get enough zinc. It's a very underappreciated nutrient. And with age, it becomes difficult to absorb. And a lot of drugs in older people deplete you from zinc. There's a lot of drugs that take these nutrients out of your body, so you really need to check that out. We do have a nutrient depletion chart up on our website to tell you which important drugs deplete which important nutrients. Now, let's start at the top. Zinc is needed to shield your brain. It creates superoxide dismutase type 1 and 3 that defend your brain. As zinc levels drop with age, there's less SOD, so you're more prone to have the death of brain cells, which is not good for your memory. So if zinc is depleted, it's not good for your brain. Zinc is needed for vision, and it's needed to protect your eyes. There's evidence that if you lack zinc, it's a high risk of cataracts, it's a high risk of age-related macular degeneration, a leading cause of blindness in older people. You need zinc for your sense of smell and taste. You need zinc to help prevent clogging, thickening, and stiffening of your blood vessel walls. You need zinc for the pancreas. The pancreas uses zinc to help control blood sugar. It does that in conjunction with vitamin D and magnesium. And the pancreas needs zinc to release enzymes to digest your food. So if you're a little bit low in zinc, it's not good for your blood sugar, and it's not good for digesting your food. You need zinc to heal. Zinc interacts with a dipeptide called carnosine. Carnosine is made out of histidine and beta-alanine, and they kind of stitch your tissues together when you're wounded. So after surgery or if you have a wound, you need zinc for your immune system. Without zinc, it's hard to make immune cells. It's hard to make antibodies. It's hard to attack and kill a cancer cell. It's hard to control viruses. So if you're on these drugs, make sure you're getting some zinc. Magnesium. Magnesium does so many things. Magnesium interacts with zinc and vitamin D to control your blood sugar. Magnesium interacts with taurine, potassium, sodium, chloride, and calcium to control your blood pressure. Magnesium is needed to make neurotransmitters in the brain, so with that you could develop insomnia, depression, anxiety, inattentiveness. I mean, you give magnesium to a child with ADHD and they function better. You give magnesium to a child who has trouble spelling and reading, along with fish oils, and they tend to do better. It's just amazing. Magnesium is needed to keep your bones healthy. Because if you lack magnesium, the calcium leaches out of your bones. Magnesium is what holds your bones together. You need magnesium for normal muscle contraction. You need magnesium to stabilize your energy in the daytime. Your energy, when you eat and when you breathe, you convert all of that into something called ATP, which is all of your energy, practically all of your energy. Without magnesium, you'd burn up the ATP in a flash. You wouldn't have any energy. So magnesium is needed. Most of your energy is connected with magnesium. So you need it to prevent tiredness and fatigue. But at night, you need magnesium to release melatonin. So you could sleep at night, so you could build bones, so you could have your immune system working properly, so you could reduce your risk of cancer, so you could reduce your daytime pain. So magnesium does so many things. It activates vitamin D. Vitamin D does so many things. Magnesium helps control your blood sugar, your blood pressure. If you're on these drugs, you really need... Most Americans don't get enough magnesium from their diet. So if you're on a drug like a corticosteroid, it's only going to compound that. And also you lose potassium. According to NAINS, a survey done periodically by the United States government, only 2% of Americans get enough potassium from their diet. Potassium does everything in your body. If you lack potassium, your blood pressure goes up, your heart races, you lose bones, you lose muscle, you become more acidic, you develop kidney stones. So you need potassium for your muscles, your nerves, your kidneys. It helps regulate your blood pressure. It helps protect you against strokes. All the people who lack magnesium and potassium, they lose muscle at a faster rate. They lose their strength at a faster rate. So potassium helps prevent osteoporosis, kidney stones. I mean, it's just so important. Make sure, if you're on these drugs, that you're getting a good source of potassium. You also lose calcium. So look at all the minerals you're losing. Listen, there could be additional minerals you're losing. They just haven't looked into it yet. But you're losing zinc, magnesium, potassium, calcium. You're probably retaining sodium and chloride. I mean, that's why you have blood pressure problems, etc. on these drugs. Calcium is at the root of energy release in the human body, energy utilization. Energy is created and released and used in little pockets of our cells. They're called organelles, called mitochondria. Your cells are loaded with them. None of that works if you lack calcium. It's at the root of energy release. And the problem is, when you lose calcium, it's not just affecting your energy. It affects your heart rate. You can have arrhythmias. It affects your bones. They could become hollowed out. It affects your nerves. Your blood vessels won't work properly. Your muscles won't work properly. By the way, calcium has been connected again and again to reducing the risk of colon cancer and reducing the risk of breast cancer. You don't want to lack calcium. It's a very, very important nutrient. So that pretty much wraps up what's going on with these drugs. I'll give you a simple fix. A good powdered multivitamin, like we have one called Multi-Energy. If you take that, it'll give you B12, it'll give you folate, it'll give you B6, it'll give you zinc, it'll give you magnesium, it'll give you calcium. Basically, the only thing you're not getting that's depleted by this drug would be potassium. But you could get potassium from berries, from fruits, from vegetables, and you could take a potassium supplement. So thank you for listening to part 2 of our episode on corticosteroids depleting important nutrients. You can find all of our episodes for free wherever you listen to podcasts, or just visit invitehealth.com/podcast. Please subscribe and review. Give us a review. You can also follow us on, I'm going to redo this exit. So thank you for tuning into the Invite Health Podcast, part 2 of our episode on corticosteroids depleting important nutrients. You can find all of our episodes for free wherever you listen to podcasts, or just visit invitehealth.com/podcast. Please subscribe and leave us a review. You can also find us on Metaverse, Twitter, and Instagram at Invite Health. Hope to see you next time on another episode of the Invite Health Podcast. Thank you so much for listening. Jerry Hickey signing off.